Alright, so let's talk about something that a lot of people deal with, UTI, also known as urinary tract infections. That are usually caused by bacteria and can be actually treated with antibiotics. However, using antibiotics too often or not taking them as directed can actually lead to the bacteria becoming resistant, meaning the antibiotics might stop working. And if this happens, your doctor might need to give you a different antibiotic. Same time, it will actually destroy your good bacteria. And recent research has shown that bacteria can sometimes hide from antibiotics by actually forming a protective layer called a biofilm and sticking to the inside of your bladder, kidneys, or urethra, which is the tube that carries pee from your bladder out of your body. So when this happens, the infection can keep coming back even after you take antibiotics. Now, the best way to deal with UTIs is to actually try to prevent them from happening in the first place. Here are some simple things you can actually do. Go to the bathroom more often, especially after having sex. Drink unsweetened cranberry juice every day. Cranberries contain special compounds that can stop bacteria from sticking to your urinary tract. Drink plenty of mineral water to help flush bacteria out of your system. Avoid using feminine hygiene products like douches or sprays, as these can actually irritate your urinary tract and make infections more likely. And if you use a diaphragm for birth control, don't use spermicide with it, as this can actually also increase your risk of UTIs. Now, in addition to these habits, there are certain foods and supplements that can help prevent and treat UTIs. So we have white and green tea, as well as vegetables like broccoli, Brussels sprouts, and garlic contain compounds that can stop bacteria from growing. On the other hand, foods high in sugar, including natural sugars like honey, can actually make UTIs and yeast infection more likely, so it's best to limit these ingredients. Certain oils like corn, safflower, sunflower, peanut, soybean, and canola oil can actually worsen UTIs because they promote inflammation. It's better to choose healthier oils like olive oil or even coconut oil. Fluoride, which is often added to tap water, can actually interfere with your body's natural ability to fight infections. So consider using a water filter that actually removes fluoride. And if you do get a UTI, you might experience symptoms like a burning feeling when you urinate, a pee that looks dark, cloudy, or smells bad, feeling like you need to pee often but not much comes out, pain or pressure in your lower back or belly, feeling tired or run down. And if the infection spreads to your kidneys, you might also get a fever or chills. So while antibiotics are sometimes necessary to treat UTIs, studies have shown that taking natural supplements along with antibiotics can actually make them work better and help clear the infection faster. If you do not need to take antibiotics, it's a good idea to also take probiotics, good bacteria, during the treatment and for at least 4 weeks after to help restore the healthy bacteria in your body and prevent side effects and future infections. Now, prior to going into supplementation, urine pH is actually very important. And to further optimize urine pH, you can adjust some dietary factors and consider supplements containing citrate, alpha-ketoglutarate, fumarate, or malate. See, baking soda even can also be used, but may be less efficient and could cause gastrointestinal discomfort. So urine pH can be measured using a pH meter or pH strips covering the range of 3 to 8. So that said, here are some specific supplements as well that can help for preventing and of course treating UTIs. So number 1, cranberry juice or extract. Look for a low sugar concentrate like FruitFast Cranberry Juice Concentrate and take 1 tablespoon 2 to 3 times a day. Or take a cranberry extract supplement like NOW Foods Standardized Cranberry, which is roughly about 1 capsule 3 times a day with meals. Number 2, Luteolin. This plant compound can actually stop bacteria from sticking to your bladder and kidney cells and prevent biofilm formation. Take 100 to about 200 milligrams 3 times a day with meals. Number 3, quercetin, another plant nutrient that can powerfully inhibit biofilm formation and make bacteria easier to eliminate. Look for a well-absorbed form like Curcuminase by Thorne Research and take 1 to 2 capsules 3 times a day with meals. Number 4, curcumin, an extract from the spice turmeric that can actually inhibit biofilm formation, stop bacteria from moving around and reduce inflammation. Take a well-absorbable form like a Pure Encapsulations, 1 to 3 capsules 3 times a day with meals. And 5, D-mannose powder, a special sugar that actually doesn't get absorbed into your body but instead goes to your bladder where it can actually catch bacteria, especially E. coli, the most common cause of UTIs, and flush them out when you pee. Take 500 milligrams of D-mannose powder mixed with 6 ounces of water every 2 hours for 5 days at the first sign of an infection. And finally, if you have recurrent or resistant UTIs, you might consider trying hyperbaric oxygen therapy. This actually involves breathing pure oxygen in a pressurized chamber, which can actually help your body fight off infection. Studies have shown that combining HBOT with antibiotics works better than antibiotics alone for clearing bladder infections. And of course, remember, UTIs are very common and nothing to be embarrassed about. By taking steps to prevent them and treating them promptly when they do happen, you can keep your urinary tract healthy and avoid the discomfort and complications of repeated infections.